Thank you very much. Welcome everybody tonight to the final webinar of this season. I feel like it's the last day of school. I want to welcome Marion Mackles, who Nicole gave an honorary doctorate to tonight, to the program. And I want to thank everybody for tuning in. I of course want to thank our friends across the street at 21 West 38th Street, the American Lung Association, particularly my good high school buddy, Serena Arabito. These guys have been instrumental in really supporting our program from day one. And, they bought me a new car. I get a new watch every week, jewelry, gifts, fancy restaurants, and I really appreciate that. So I want to thank the American Lung Association and keep your donations coming in to the Better Breathers Clubs. I want to also say thank you to everybody who signed on. When we started, this is the first year we've actually done webinars. Usually we do them in our place, and although they are warm and cuddly and we get to hug at the end, this webinar has really allowed us to reach so many more people, and it's something that I've wanted to do for so many years and just didn't really know how. People ask us all the time, are we going to open another center? Are we going to come to another city? And as much as I would love to, have the MIC Pulmonary Center in every city, really what we do is something that's so specific and so special, and it takes really paying attention every single day to every single patient. And with that in mind, it really takes having the right team of people. And, I could say over and over again, my team, I'm not going to say we're the best, but what I'm going to say is that, I would put our team up against any other program and randomize patients, and I think we're going to stand on our own. But it really takes time to develop a team, and right now I think we really have an outstanding team of therapists, physiologists, and, having Marion here, I just want to say, Marion and I started the Pulmonary Center in 1998 when it was just the two of us in a tiny room. So we've been working together for almost 21 years. And so she knows more secrets about me than anybody else in the world probably, but this person is a good physical therapist, and particularly a cardiovascular and pulmonary physical therapist, and particularly a great chest therapist. And I always say, if she cannot get the mucus out of you, then the mucus is not coming out of you. So that being said, let's get started. Again, I really want to thank you all for signing on, for being loyal, for sending us your comments and questions. It definitely means a lot to me. And when people write in and tell us how much they've learned and how much better their lives are and how much more they can do, that's really the essence behind what we do and why we do it. So, please keep it coming, keep your questions coming, keep your comments coming, keep, whatever questions, comments, feedback you want to give us. So, I've taken 4 minutes with that, but I think that was worthwhile, and it gives me a little warm up. So let's get going on some actual scientific information. So tonight is, if you've been keeping tabs, the 5th link in the chain of ultimate pulmonary wellness. So just as a review, for those of you that have been on outer space for the last 6 months and have not been paying attention, or have had computer glitches the whole time, when we talk about ultimate pulmonary wellness, we really have developed a concept here that, what I've come to believe are the 5 single most important things, or the 5, things that are key in terms of really achieving your best pulmonary wellness. And so, first and foremost, we consider 20% of the puzzle to be medicine. And when I talk about medicine, I'm talking about having the right doctor, having the right medical professionals on your team, taking the right medications, and taking them properly. Okay, and we've talked about that before, and we'll talk about it again in the future, but that's not really what we're here for tonight. But medicine is 20%. The next component of ultimate pulmonary wellness is exercise. And again, I think that there are few behavioral changes that you can make that will have the single impact on so many body systems and the overall way that you feel as exercise. And so we've talked about exercise. The webinar for exercise is also up. So incidentally, time for shameless plug number 1. So we've now uploaded the first 8 lectures of this year onto our website, www.pulmonarywellness.com, and people have asked for them. We were going to try to sell them to you, but we've decided to be like Crazy Eddie and give them all away. So go to www.pulmonarywellness.com and go to web archives, and you can see the first 8 lectures from this year. and the last 4 lectures of the year will be up within the next 2 or 3 weeks after I have a chance to edit. So exercise is the second component. Nutrition, also crucial, making sure you're the right weight, not too heavy, not too light, eating the right foods to support respiratory function without harming yourself. Also, stress management, relaxation, mood, emotional. So making sure that you're taking care of yourself from an emotional point of view, because we know that living with a chronic disease is very anxiety provoking, okay? Having this anxiety, having this disease, getting weaker, not being able to do much, being confused about how to best take care of yourself can lead to a lot of anxiety and depression. The more control you get and the more you learn about how to best take care of yourself, not just from taking more medications, taking them more frequently, adding different medications, but really from a lifestyle perspective, is very empowering as well. And then finally, the last component, which we're going to talk about tonight, how to keep your lungs clear and free of infection. And that is a complex topic, but we're going to try to break it down to how to keep your lungs clear and free of infection, not for dummies, but for people who are somewhere between Cro-Magnon man and I would say smart gorillas, okay? So we're going to try to make it very simple for you tonight, and please keep your questions coming. I do have some questions that were sent to me during the week, and I'm going to get to those as well. But let's start about how to keep your lungs clear and free of infection. So those are two separate things that are very closely related. So when we talk about keeping your lungs clear, what do you think? Okay, when we listen to your lungs, or when your physician listens to your lungs, what are we listening for? We want to listen to, number one, how much air is moving in and out. So are you aerating all the areas of your lungs well? And we also want to hear that your lungs are clear, okay? And that there aren't any what we call, adventitious sounds. And when we, a lot of times people will say, oh, my doctor said it sounds like I have a symphony in my lungs or something like that. And so what we mean when we say adventitious sounds are things that we call rails or crackles. Some people say raws or crackles. These are rails, crackles, wheezing, and all these things will tell us different things about what's going on in your lungs. So it's going to, by listening to your lungs, we're able to tell, number one, are you moving air in and out effectively? Are you getting air deep into your lungs? Is there tightness in your airways? Is there mucus in your airways? And all these things are related to how to keep your lungs clear and free of infection. Now, let's start with keeping your lungs clear, okay? And for this, we could use a little bit of an anatomy, review here. So essentially, we know that air enters through the nose or the mouth, it goes down into the throat, goes down into the trachea, and I'm going to show you this trachea, okay, which is, I think, a little bit better. But essentially what happens is, from the windpipe, okay, once you get to about here, the trachea will split into what we call right and left main stem bronchi, okay? And that will go, the right one will go to the right lung, where you will have 3 different branches, okay, going to the upper, middle, and lower lobe. And then we have the left, which will branch into 2, going into the upper and lower lobe. So just remember that in order for air to get into your lungs, it has to go through this entire airway system, or the entire bronchial system, before it gets in there, okay? So we want to make sure that we're keeping that free and clear. Now, how do you keep it free and clear? There's a lot of things that we talked about. So number one, taking your medications properly. So if your airways are tight, if you're not moving air in and out effectively, your medications will help with this. Things like bronchodilators, which we know open up the airways in the lungs, and things like anti-inflammatories or steroids, which we know reduce inflammation, okay? By moving air in and out freely, it helps your body's airways to relax, and it helps you further move air in and out more effectively, okay? And we'll talk about that a little bit more as we move along. So let's talk a little bit about mucus, okay? And we'll talk about mucus. You know what, let's not talk about mucus right this second. Let's talk about mucus as we get to the end. But let's talk right now about how to prevent infection. When you have a lung disease, when you have heart disease, when you have kidney disease, when you have liver disease, all of these things are going to make you more susceptible to picking up an infection than the average person who does not have a chronic disease. Okay, so keep that in mind. If you're listening to this, then odds are, and I don't have to tell you this, you are going to be more likely to pick up an infection than the average person. Okay? So that has a lot to do with the immune system, but it also has to do with the anatomy and physiology of your airways. A common thread that I hear from people over and over again is that I get sick once a year, and that could be I get bronchitis once a year, I get pneumonia once a year, or I get a cold and it always settles in my chest. Why is that? It's because you have a chronic respiratory disease, and that's going to be your weak link, okay? So there's a number of things that you can do in terms of your everyday activity to prevent infection, okay? So let's talk about those a little bit. Let's start with the fact that, in general, most colds and flu, okay, are going to be caused by viruses, okay? Sometimes there's going to be bacterial infections, sometimes there's going to be bacterial pneumonia, but when we talk about the flu, obviously we're talking about a virus. Now, the key is, in terms of preventing infection, we want to avoid infection. So let's start with that. So how many people, I hear this story from a lot of people, I am not going to come in today because I have a cold. Well, how did you get a cold? My grandchildren were in for the weekend and they were all sick, okay? So that's a really heartbreaking example, because a lot of times people want to talk about the fact that, they haven't seen their family in a long time, they're coming in for the weekend or they're coming in for the holidays, and all the kids are sick. Now that's a big question. So the question, my advice to you in that situation would be, should you see them? If you want to prevent an infection most optimally, then the answer is no, okay? But most people don't choose that route, okay? And I'm not saying that I would choose that route either, but the overwhelming majority of people don't always have the luxury of not coming in contact with people who are sick. So first idea is avoidance. So avoid people who are sick, okay? Don't get the wrong idea. I'm not saying avoid children, but children are sick often, okay? Children often get sick a lot. So if you know that someone's sick, then please, by all means, avoid those people. And likewise, if you're sick, then try to stay away from people that you don't want to get sick. Try to stay close to the people that you do want to get sick. No, I'm just joking. But what happens a lot of times is you'll be in the elevator with somebody and you hear them sniffling or coughing or blah, 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 and you look at them and they go, oh, I have a terrible flu. And my question is, well, why are you coming to work today, okay? Why am I in the elevator with you, okay? And so for my staff and my patients, the overwhelming do not violate this rule is, if you are sick, you do not come to the pulmonary center, okay? So that includes staff. So if I'm sick, I don't come to the pulmonary center. If 5 of my therapists are sick, guess what? The pulmonary center is going to be closed, okay? Because the last thing that I want is for you to come to the Pulmonary Wellness Center and catch a cold that for you is going to be much more severe than for any of us. So first rule of thumb, if you're sick, stay home. And that includes, if you're sick, stay away from other people, okay? Who are, and if you know someone who's sick, definitely stay away from them. So again, that goes for patients too. A lot of times patients come in and we'll say, how you doing today? And they'll say, I have a terrible cold, or I have a terrible infection, or I have, not often do people say I have pneumonia. Usually they know if they have pneumonia, they have to stay home. But people say, I have a terrible cold, okay? The first thing we do is we quarantine these people, okay? We don't necessarily put a plastic bag over them, but we try to get them out of the pulmonary center as quickly as possible, and we wipe down anything that they may have touched, okay? It's not because we don't like them, it's not because they have the cooties, it's because we have a responsibility to protect everybody at the pulmonary center. And now think about this, which is something that people often have a hard time really paying attention to. You have a responsibility to yourself and your family to remain healthy, okay? If you see your grandchildren and then you catch a cold that settles in your chest and you wind up in the hospital, guess what? That doesn't serve anybody any purpose. And as heartbreaking as it may be to, not be able to take that trip to California like you were planning or anything like that, we're looking at the long-term big picture, and we're trying to get you to take care of yourself for the long term, okay? So first and foremost, avoid people who are sick. If you're sick, avoid other people who are not sick. So stay home, okay? Next order of business, okay? How do you think most colds and viruses are transmitted? Okay, when I count to 3, everybody scream how you think it's transmitted. 1, 2, 3. Exactly right. Okay, so here's how it's transmitted. The way it's transmitted is you somehow come in contact with this virus or bacteria, and then you bring it somewhere to your body, and in most cases, okay, it's going to be your nose or your mouth, your ears it could be, but usually your nose and your mouth. And you're going to touch your face, your eyes. Thank you. I knew I had a third one that I was thinking of, but everyone here is pointing like this. So your nose, your mouth, your eyes, anything with a mucous membrane where you're going to be able to, to bring this into your body, and then it gets into your bloodstream and spreads. So my grandmother used to say something all the time. She'd say, "Don't potchki your face," okay? And what she meant was she was really talking about don't pick pimples, don't pop pimples when I was a teenager, okay? But I'm going to say don't potchki your face when it comes to being sick, okay? Now, that being said, okay, how do we get these things on our hands, okay? So think about it. In New York City, we take the subway all the time, okay? People say, I don't want to go to a hospital, I don't want to get sick. The New York City subway, trust me, is a petri dish of every single possible disease that you probably can get. And think about it. You're holding on to this rail, okay? Or you're in a taxi, okay, where maybe somebody who was just in it for 15 minutes coughing their pneumonia virus all over that taxi and all over that seat, and handling money and touching the door, or holding on to that pole with their bacteria, okay? And then you touch it and you introduce this into your body, and then a couple of days later you are sick, okay? So first order of business is frequent hand washing, okay? How often should you wash your hands? As often as you think about it, okay? Non-stop, okay? You shake hands with somebody. I don't shake hands with people, okay? Number one, because I don't want to get sick. Reasons 2, 3, and 4 are no. I can't tell you about my. But George W. Bush. And I don't quote George W. Bush a lot. I don't use him as an example very often, but George W. Bush doesn't like to shake hands with people for exactly that reason. And he's smart about not shaking hands with people, okay? So this, okay, as much as you want to be friendly to people, I don't know where your hands were. I don't know if you were just in the next room going, huh, 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 huh. Okay? There's an old joke. It says, how do people get hepatitis? I don't remember if it's B or C. They say, how do you get it? And they go, welcome to an unnamed fast food chain of your choice, have a nice day. You know what I mean? And that's the same type of thing. If you don't know exactly what that person was doing right before you shake their hand, don't shake their hands. Same thing, we're sitting around a table here, okay? Think about it. You go to the doctor's office, you're sitting in a chair. I don't know how often that doctor is sending someone out to the waiting room with some antibacterial pads and wiping down the armrests of the chair or washing the chair. Now, if you come to the Pulmonary Wellness and Rehabilitation Center, you will know that the overwhelming majority of our budget goes to antibacterial wipes. Why? Because as soon as anybody gets off of a machine, we are wiping them down with antibacterial Santa Claus. If somebody gets up from a chair, we're wiping it down. We have Purell all over the place because we want people to use it, okay? So that's another way. Now, you don't always have access to a sink, okay, but you do possibly have access to these antibacterial gels, and it's wise if you have a pulmonary condition to to carry that around with you. And then there are going to be people who will be the devil's advocate and they'll say, yeah, but those things are so bad for you, they cut down the good bacteria, blah 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 blah. Let me tell you something. I would rather cut down the good bacteria a few times a day than not kill the pneumonia that has gotten on my hand, or the rhinovirus, or the pig swine flu, or something like that. So please, frequent hand washing, constantly, non-stop, anytime you shake hands, anytime you're in a public space where you're touching things, anytime you're sitting in a, just think of it all the time. Just think that anything you could possibly touch. There's a great commercial, I don't know what it's for, but it's a classroom where they say, okay, children, pass up your papers, and the kids pass the papers forward, and they show that there's these different viruses and bacteria on each thing that gets passed up to everybody one over and over. And it's, again, same thing. A lot of these things can live for 24 hours or more in a space like that. So frequent hand washing, and also antibacterial spray. I'm going to just stop for 1 second, and I'm going to let Marion talk a little bit, because I've been talking a lot, and I don't want to have her here for nothing. But comment on, let's talk about hand washing, anything else you want to talk about.
Can you
Yeah,
hear
we
me?
can hear you.
Okay,
You're good.
good. Hand washing. Well, you know what? When you were talking, I always remember what my mother used to say, and I grew up not really trying not to do it, but every time we entered the house, it was, did you wash your hands? And I find that as a mother, I don't do that. I stopped doing that with my children, and parents all over the place do not do that anymore. But we've sort of let those things go because we are under the illusion that we're a clean society, or we have all these medications that can help us, or there's antibacterial everything. But a good thing to do is, and I've gone back to having my children do this because I don't want to get sick, and I think I do a pretty good job not doing that every so often, unless I want a good vacation. But coming home and washing your hands. How simple is that? You have the whole day on you. You don't get to use Purell, let's say. You forgot it. But get home, wash your hands. When people enter your house, you know what? Whose life is this anyway? So you inconvenience us. I'm sorry, could you wash your hands? And then come in, or have something by the door for them to wipe their hands off. It is your life, not theirs. Who's going to get sick? You are. So, it's your house. When you come home, it sort of goes with washing hands. Change your clothes. That's
definitely
scrubs. Have your home clothes and your outside clothes. You've been how many of you go to the doctor, and run around in those clothes all day? You get home, you're eating dinner with them still on. Come home, just take them off, wash your hands, and I hope that will help keep you a little bit healthier.
Excellent points there. Another thing is that when I first started working at the medical center, NYU, I was sick almost the whole first year. Okay, now I don't get sick at all because I'm probably immune to everything. And so don't get the idea that just because you had something once before, you can't get it again. But Marion makes a great point. Okay, you come home, think about your family, think about your home. Do you really want to bring all of that stuff from your day home and put it in your house? So, come home, take a shower, wash your hands, change your clothes, and so on and so forth. So, that's a very good point. When we come here, okay, we have Purell right at the door. So what we want, it's like people say, there's a saying, leave your baggage at the door, pick it up on your way out, okay? So we don't know how you came in, but we hope to send you out cleaner than you came in. So when you come into the pulmonary center, or when you come into any place, okay, Purell, okay? If you use that Purell, the first thing when you walk in, we know that you're not going to be touching chairs, tables, treadmills, bikes in the pulmonary center and bringing everything that you just brought with you from the train on. And you can be sure that when you're here, we'll take care of the machinery, we'll take care of the things that you're going to touch while you're here. And then before you leave, guess what? Wipe it again. Use the Purell again, just in case. Same thing after using the bathroom, okay? It sounds so basic and obvious, okay, but they have done studies where people wait in the bathroom at medical conventions to see how many people wash their hands. I watch this when I go to the airport. And you know what? Not everybody, and I'm using that term loosely, washes their hands. So it's like driving, okay? It's like I don't worry about myself as a driver. It's the other person that I worry about. Same thing with preventing infection. So it's not me. I know I'm clean, but I'm worried, did Marion wash her hands today? That's why we infrequently shake hands. One of the other reasons, just joking. So that's one thing, and that's one thing that, believe it or not, I guarantee if you just implement that practice, I think in some way that's going to definitely improve your health in one way or another. Let's talk about other things. So prevention. Okay, so flu shot, pneumonia vaccine. And this is something that people ask about all the time, okay? If you are over 65, okay, if you are a heavy cigarette smoker, or were a heavy cigarette smoker, if you have heart disease, lung disease, diabetes, alcohol dependency or previous alcohol dependency, liver disease, kidney disease, or anyone who could in any way potentially be immunocompromised should have the Pneumovax, okay? And the question comes up over and over again, how often should I have the Pneumovax? You know, and for most people, okay, and now again, disclaimer, don't go home and say, Noah told me I shouldn't do this. I never tell you what you should or shouldn't do. I'm only telling you what I have learned and experienced with my patients. But the overwhelming majority of physicians that I know recommend the pneumonia vaccine at least once every 5 years. And I do know a few who prefer it every 3 years or every 4 years. As far as the flu shot, how often should you get it? When I count to 3, everybody say how often? 3. Exactly right. So you should have the flu shot every year, okay? Trust me when I say it is so much easier to prevent yourself from getting sick if you do some of these things, okay? This is like routine maintenance on your car. So please do the routine maintenance. There's some stuff you're gonna do annually, there's some stuff you're gonna do monthly, there's some stuff you're gonna do daily, some stuff you're gonna do hourly, okay? Hopefully you're gonna be breathing every minute, okay? But the point is, we don't want to pick you up on the side of the road after you've crashed, okay? And what does crashing mean? It means different things to different people, but the last thing we want is for you to wind up in the ICU because you took a plane and you were already feeling sick before you took the plane. I came back from Peru about 2 years ago, and I was sitting next to somebody coughing the entire flight, okay? Vigorous, vicious, wet cough. I knew this person was sick. Not only that, the person kept blowing their nose and putting the tissues into that pouch in front of their seat. Not only was I nauseous from that, okay, but I came home and sure enough, within 3 days, I had a cold. And I knew I was gonna have a cold. How could I not have a cold? As much as I, you know, have a good immune system, I knew sitting next to the sick person meant I was gonna have a cold. And the other thing that I wanted to comment on, you know, that Marion mentioned initially is that she said it's your life, okay? And that is so true. And a lot of times, you know, we as human beings, you know, we try to please others. We try to be polite. We try to make sure that other people are happy and not offended. But you know what? When it comes to your health, trust me, as I've said many times, lung disease is a serious disease. It's a killer. It's big, it's gigantic, it never gets tired, it never stops coming after you, okay? So any little chink in the armor or kink in the armor, I never know what that says, but any little lapse in your protection is opening up and is an invitation for bacteria or virus to enter your system. So as much as you don't want to say, Carol, you know what? I know we have those expensive tickets to the theater tonight, but you just told me you have a cold. And you don't even, I mean, if you're smart, you're not going to say why it is, okay? But you're going to say, you know what? I'm feeling under the weather, or I just can't make it, or please give the ticket to someone else. And also, you know, again, it's heartbreaking when it comes to family that you haven't seen in a while, but if they're sick, okay, protect yourself. If you get sick and wind up in the hospital, or even worse, you're not doing anything for anybody. So again, so far we're with frequent hand washing, making sure you're protected with flu shot and Pneumovax, pneumonia vaccine. You want to say that?
I just thought of something in terms of, okay. I just thought of something in terms of, am I on?
Can you hear her?
Okay. I just thought something in terms of cleaning and what you just said, because this is one of my pet peeves. Swipe computers, clean your phone daily, constantly. I have visitors in my house right now, so I have cleansers and they both actually are ill, and I have cleansers right near my computer. Once they finish typing, it gets swiped. My kids know they have to swipe the keyboard. It really helps prevent, actually they've done studies where there's a lot of germs on keyboards. If you're just using it, you know, and you haven't washed your hands recently and you've come home and done other things or touched your nose, you're growing bacteria and other things on your computer. Same thing with your telephone. We always clean our public phones here at the center every day. And also that tissue story, because that is so gross. And it is just so gross. And tissues really, really bug me. And I can't tell you how many of our patients think that this right here, the sleeve, is like a tissue holder, or their pockets, and you know, when they sneeze and we bring a tissue over to them, they go, oh no, I have, and they pull out.
That's called grandma's tissue box.
Oh my God, it is so gross. Do you know what you guys are growing in that thing? Or men, more men than women. And it's generational, because I don't see many women or men carrying hankies anymore, but some do. And you know, they take it out, and it's like, it's disgusting to see what's already on it, and they put it back in their pockets, and they're touching it with their hands. So, you know what? Throw your tissues out. If you're in a place where you can, carry a little plastic bag, and when you're done with that tissue, you put it in your little portable, you know, snack-sized garbage bag, and put it in your purse, and when you get home, get rid of it. But yeah, okay, that's it.
Yeah, I mean, great point. I'm all for a pocket square, okay? But seriously, I don't know who thought of this idea of like, let's blow something disgusting out of our nose and save it so that later when we want to blow more disgusting stuff out of our nose, we still have the stuff that we blew out of our nose before, okay? It is a petri dish, okay? So understand that you take that handkerchief, you put it in your pocket. Now your pocket's contaminated, okay? Now maybe you put some money in that same pocket. Now you give that money to the guy who is selling you coffee, or maybe that guy has a handkerchief, or maybe that guy has not washed his hands and now he's giving you your coffee. These are the things I think about all the time. I've actually had situations where I've purchased food, okay, and I see the people sneeze into their hand, okay, then hand me my food. And I walk right out of that place and I throw that food in the garbage because I'm not taking that chance. So sneezing, again, it used to be this, okay, now it's this, okay, so you don't want to do this, but sneeze on your shoulder, clean off your shoulder. And those are real prevention things that we're talking about. So those are things you could do on a daily basis, frequent hand washing, on a yearly basis, flu shot, on a every 3, 4, 5-year basis, depending upon what your doctor says, pneumonia vaccine. And then just one thing, you know, a lot of people say, well, I don't want to get the flu shot because, you know, last time I did, I got the flu. And you know, the overwhelming majority of flu vaccines that people get right now do not contain a live virus, okay? And so with that in mind, it's unlikely that that will cause the flu, or a lot of times people say, well, I got the flu shot last year, but I got the flu anyway. And there is very hardcore evidence that shows that, number one, it does prevent the flu. It cannot prevent all flus, okay? There's no vaccine that's going to prevent 100% of everything that it says, especially with a virus that's constantly mutating and changing, which is why the flu shot has to change every year, okay? But even if you do get sick, there's overwhelming research that shows that very often it's not as severe as it might have been had you not gotten the actual vaccine. So that being said, those are some actual actions you could do. Now we'll talk about a few other things and how they actually affect keeping your airways clear. So let's talk about basic anatomy and physiology. So the overwhelming thing that we talk about a lot is mucus, okay? That's one of the hallmarks of lung disease, okay? Particularly COPD. Of the COPDs, particularly chronic bronchitis, people who are purely emphysema have less mucus. People who have restrictive diseases like pulmonary fibrosis have less mucus, but it's present in all, and so we should still always have a goal of, you know, clearing our lungs, keeping them free of mucus. Now, what is mucus, okay? Mucus is not all bad, okay? Mucus is actually protective. So the idea behind mucus and mucous membranes in general is that if you're standing on the corner of 38th Street and 5th Avenue in the middle of summer and it's hot and humid outside and a giant truck blows by and puts like a whole bunch of exhaust in your face, okay? That mucus is designed as a trap along with the cilia or the hairs in your nose in order to prevent that from entering your lungs, okay? But what happens a lot of times in lung disease is that people actually wind up with a hyperproduction of mucus, where they produce so much mucus at a pathological level because they're always some form of inflammation or some form of trigger, or very often the disease process itself will cause mucus production. The issue then becomes, how do we get that mucus out of our lungs so that we can keep our air moving in and out effectively and also prevent infection? The longer that mucus stays in your lungs, okay, the greater chance you have of it blocking your airways, of catching an infection, of you really picking up something and not functioning as effectively. So what do we do about that? Let's talk about the evaluation of mucus. So when I see a patient for the first time, I want to know about their mucus. And as gross as that may sound, we need to know that. If we are taking care of pulmonary patients on a regular basis, we need to know that information. So here's how my line of questioning will go. First of all, are you coughing? Okay, that's the first question. We always want to go and understand that there's something called a differential diagnosis, or there's sort of like a flow chart, which sort of helps you figure things out in terms of medical issues. And you could probably use this for other issues as well. But too often in today's fast-paced medical world, there's so many knee-jerk reactions where somebody says, you know, when I sleep, I get heartburn, and then there's a rush to push the buzzer and say, what is GERD, or gastroesophageal reflux, or something like that. Or I have a clicking in my elbow, and you know, boom, what is tennis elbow? Without really going through the steps of figuring out what exactly is going on. So just to give you an idea of the question that I ask patients when I see them for the first time, because when I see you, with the idea of ultimate pulmonary wellness in mind, I need to make sure that you have some kind of infection prevention / secretion clearance program in place. So here's my questioning, and understand that right now I'm talking to you. So ask yourself these questions, okay? Number one, are you coughing? Now, ideally, we're not gonna cough, right? Because who likes to cough? So coughing is usually indicative of a problem. So are you coughing? If the answer is no, that's great. Or some people will say, yes, I'm coughing, no, I'm not coughing, I only cough when I get sick. Okay, so if you only cough when you get sick, well, that's a pretty good radar alert that when you're coughing, you might be getting sick, okay? But if you're coughing and the answer is no, great, I move on. If the answer is yes, I am coughing, then my question becomes, is your cough productive? Have you ever heard that before? And, you know, if you are not medical, then that might sound like a funny question, because you might say to yourself, well, he tries to earn a living, or well, he tries to do, but when we say, do you have a productive cough, what we mean is, are you bringing up mucus, okay? So, are you coughing? Are you bringing up mucus? If the answer is yes, I'm coughing, but no, I'm not bringing up mucus, that leads me to another question. So is that question then, no, I don't have mucus, or I don't have a pathological amount of mucus, which is great, that's what we want, or is it that I have this mucus, but I can't clear it? Because that's the scenario that's gonna get you in trouble, okay? And a lot of times people report that, oh, I hear it rattling around, but I can't bring it up, okay? So the answer is, are you coughing? If the answer is no, great. If the answer is yes, do you have mucus? Or do you have a productive cough? If the answer is no, then we say, is it that there's not a pathological amount of mucus, or are you not able to clear it? Now, if you have mucus and you hear it rattling around, or when we listen with a stethoscope, we can hear that mucus in your airways, then we know we have to get you on some type of secretion clearance program. And Marion is the chief of our airway clearance unit, where we have a whole host of different methods that we're going to talk about next month, of ways that, number one, we can clear your secretions for you in a treatment, and ways that you can also clear your secretions on your own and prevent you needing a treatment. So that becomes, if you are coughing and you do have mucus but you can't clear it. If you're able to bring it up, then the questions become, is it thick or thin? So understand, and also the idea of are you able to clear it, okay? Look at how some of these bronchi point downward, okay? And so if this is the area where your mucus is, you can cough till the cows come home and you're not going to be able to spit it up, because essentially the cough mechanism is only effective from here, the point where it splits, which is right over here, which is higher than most people think, because you can get that mucus all the way down here, but until it gets up here, you're not going to be able to clear it, okay? So what that means is that when you're in the upright position, gravity is actually bringing most of this mucus down, which is why a lot of people say, when I lay down at night, or when I lay on my side, first thing in the morning is when they usually produce the mucus. That's because they're putting their airways in a position where the mucus can actually drain. And so when you have that mucus first thing in the morning, be sure to cough it up and spit it out before it actually goes back down. So I often, show people this picture, and I explain it to you like a ketchup bottle. So if I want to put some ketchup on my fries, don't eat fries just because I do what I say, not what I do. But if I have the ketchup in an upright position, I can shake it till the cows come home, and I can pound it till the cows come home. No ketchup is coming on my fries, okay? But an old Heinz commercial, Heinz, please send me the check later, but is to tip the bottle, and if you press on the 57, in other words, put it in the right position and tap it in the right way to help get that ketchup out. And it's the same thing with mucus. So if you are one of the lucky people to see Marion for a session on chest physical therapy, what she's going to do with you is she's going to put you in exactly the right position, and she's going to percuss you on the 57 to help you clear those secretions, okay? So again, why I started talking about this is the fact that I asked you, is your mucus thick or thin? The thicker the mucus, the more it's going to cling to that bronchial tree, and the less opportunity you're going to have to clear it out. And that goes back to something that we talk about all the time. Fluids, okay? Drinking plenty of fluids, because if you are dehydrated, the more dehydrated you are, the thicker your mucus is going to be, the less opportunity you're going to have to clear that mucus. The more it's going to get stuck, the greater chance of infection. And so now let's just talk about hydration for a second, okay? A lot of people think it only has to do with how much you drink. It doesn't, okay? So here's a good rule of thumb. By the time you're thirsty, you're already dehydrated. And a lot of people think that the only way we lose fluid is by peeing, and that's also not true, okay? One of the ways that we lose fluid most significantly is by blowing it out in the form of water vapor. And this happens particularly at night when we sleep, okay? So with this in mind, it's very important that your room be hydrated. In New York City, you know, the heat is very hot, to state the obvious. It's also very dry, okay? So if you're breathing in and out that dry heat day in and day out while you're blowing out water vapor, you're actually losing fluid over the course of your day, making your secretions that much thicker, making them more difficult to cough up, okay? And so is your mucus thick or thin? If it's thin, great, it's going to be easier for you to clear. If it's thick, then you need to think about increasing your fluid intake, adding a humidifier to your room, particularly at night, nasal rinses, you know, and other things of that nature, which Marion, I'm sure, will touch on in more detail later. And then the final question about mucus is, what is the color, okay? Under normal, healthy circumstances, mucus is supposed to be clear, white, clear or white, okay? So essentially, that's what it's supposed to be. So the warning signs are yellow, green, clear signs of infection, okay? But also here's something to think about. When it's yellow or green, that could also mean it's coming up from deeper. It could also mean that you're not hydrated enough. And then the last thing that we talk about, red, okay, which is usually blood, is always going to be a warning sign, okay? So anything like, if you notice a change in your mucus from white or clear to yellow, green, particularly red, that's something you want to get on the phone with your doctor very, very quickly. And that leads to my next point, which is that if you feel like you're getting sick, a lot of people say, let me wait a day, let me wait a day or two, let me wait a couple of days and see if I feel better. Trust me, a day of getting sick is not the same for somebody with respiratory disease as it is for somebody who's not. Now, nobody wants to get sick, okay? But particularly for people who their lungs is the most susceptible, you want to talk to your doctor ASAP. And what a lot of physicians do is they will give their patients an antibiotic to keep in their home so that in the event that they get sick, they know that we can nip this in the bud before we start getting into a trouble zone. And then other things that I want to talk about, essentially, if you can't clear secretions, okay, particularly people with chronic bronchitis, bronchiectasis, cystic fibrosis, non-tuberculosis mycobacterium, NTM, things of that nature where you're constantly producing mucus. If you can't clear it on your own, then you need to have a session with a chest physical therapist who can teach you, who can, number one, beat the mucus out of you, okay, or beat the stuffing out of you, or let's leave it at mucus and stuffing, but, who can beat it out of you and clear you out, okay, but also get you on a program so that you can start to get on really a secretion clearance program, preventative program that you could do daily, hourly, weekly, as often as the therapist needs you to do. And I think that this is really a great time to turn it over to Marion, because, again, like I said, I'm biased towards Marion. Besides the fact that she has enough secrets about me that she could blackmail me, pretty much for anything. We've been working together for 20 years, and that says a lot about Marion. So in addition to the fact that, I have the utmost respect for her as a human being and a person, she is quite simply the single best chest physical therapist that I've known, and I've known quite a few, and I've known some great ones, but she has taken it to a new level. Like, she has brought us to new places in Mucus Town that we have not seen before here at the Pulmonary Wellness Rehabilitation Center. So I want to turn it over to her to talk a little bit about postural drainage and chest physical therapy, what that means, also some of the devices that people talk about, the positive expiratory pressure devices, and also the vest, and also some other things that we're prototyping now. Tonight we're really going to give you an overview. We're going to talk a little bit about theory and how this comes into a chest, keeping your lungs clear program. But next month in September, Marion is actually going to go through all of these devices with you and try to expose you, not in that way, but expose you to the various treatment options that are out there for you, and a lot of these things that you can be doing on your own, that if your doctor hasn't recommended these things to you, maybe you could go and say, hey, I heard about this Acapella or Flutter or so on and so forth, and maybe that would be helpful to me. So tonight is going to be a little bit of an overview, and then next month we're going to hit it hard. So without further ado, I'm going to turn it over to you, Marion.
All right.
Yep, you're good. You're good.
Okay. Thanks, Noah. That was a mouthful. What I want to really say is, in terms of airway clearance, is that a lot of people will come to us and say, my doctor, or I've never been told that I needed a device. I believe personally that every human being needs to do some form of lung clearance. If you take yoga, there's all that deep breathing to help open up your lungs. I think everybody on earth should be doing something, especially with any sort of lung disease. So I want to take the example first of the person who says, I never cough up anything. That doesn't necessarily mean that, you don't have mucus up there. It may mean that you're able to bring it up a little bit more in a normal fashion and then clear it by and swallowing it or coughing. And there are a lot of people who actually are productive, and they don't realize that after they cough it up, because of some people don't like to spit it out or think it's disgusting, so they consciously make the choice not to, or some people just out of habit swallow it, which is okay. If you have a large amount, you might end up feeling a little nauseous from the amount of mucus you're swallowing, but the stomach is there to kill any sort of bacteria or germ that's in that mucus. But if it's a small amount, we all bring up mucus every millisecond of the day. We all have it coming up. We swallow it, we clear our throat if we get a little too much, it goes down, we cough, just like everyone else. The most important thing I think, to tell you the truth, is trying to get a deep breath in. There are drainage positions that are very specific for different segments and lobes of the lungs. For most people, unless you have a pneumonia somewhere, or for people with cystic fibrosis where it's really important, where they might clog in one specific place, and this is not new information, this is information that's all over the place, then you might need a very specific position where your doctor has told you through a CAT scan and x-rays that this is the point. Because when you're actually listening with the stethoscope, you can pick some generalized areas, but you can't get that specific. So there are specific drainage positions that if we know from a doctor that you need to drain in that position, it's very easy to learn. In general, though, to help clear, I really find that, first of all, most of us are in a drainage position all day long, it's sitting or leaning back, in your comfy chair. The problem is that we're not focused on a deeper breathing and a type of breathing pattern that can help bring up that mucus. So there are ways to do that. There's one before, there were all these devices and vests. There was something called active cycle breathing, which is a pattern of various types of breathing deeply, slowly, huffing, coughing, etc., put all together that help bring stuff up. And we will be going over that if you join us in September. This is, this is just the coming attraction. We'll have the time to really teach you how to do that.
Incidentally, my birthday is September 15th, so now would be a good time to start shopping.
Okay.
All right.
So, I'm not going to tell you what to get them. Anyway, so that's one thing. But these positions are good for the clearing the upper part of your lungs. Other positions are even just like leaning forward on a table. It gets more in depth. Laying down, laying on your back does help bring stuff up in terms of some of the upper portions again of your chest. Laying on your stomach if you can, but a lot of people can't tolerate laying on their stomach. But there are other ways besides the postural positions. In terms of what is chest therapy, because no one said a lot about it and talks about people getting beaten up. You're not really beaten up. Some of you have had it, and a family member has been taught to do it. The one problem with it, that why people think they're getting beaten up, is because there is a lot of, what people call banging or slapping, but it's not. It's actually called percussing, or I like to call it cupping, which is what it is, and not I just like to call it. It is also called cupping, because your hands are in a cup position. If someone is doing it in a properly cupped position, it shouldn't cause you discomfort. You're not going to feel like somebody's banging you. The whole idea is that you're vibrating air molecules, and that's causing a vibration in your lungs to help loosen that mucus up so that hopefully you can then bring it up. So that's basically what happens when you're having a chest therapy session. You get a little bit of percussing, a little bit of vibrating on the rib cage, rib mobilization by springing, etc. There are devices, a lot of devices, HEP devices that are out there, a lot of valves. That some of you might have heard of. There's one called the Acapella, there's the Flutter, there's the cornet, there's the flute. There's more than I can, there's one coming out every day. They're great. You have to find the one that works for you. Unfortunately, because of price and and accessibility, you can't go into a store like a shoe store and try them out and say, oh, and finally say, oh, or take it home from the store and try it on and then bring it back if it doesn't work. So, we have jumping off points for different patients according to, what their life is like. Everything has to work for you. Let me backtrack a little bit. Whatever you do, it has to work for you. It has to fit into your lifestyle. You are the one who is going to have to do it. And that's the big thing, is you doing it. I mean, already a lot of you are getting up. You're trying to clear. You're trying to do your nebulizers. You're doing your meds. Then it's getting out. And maybe you're on an exercise program. There's so much that you have to do in your life just to cater to the disease that you don't have time for life. I want to make sure that, I try when I work with a patient to have them say, is this working in my life so that I can have a life? That's the most important thing. So we try to get you the best device that will work for you and work for your life so that you can go and enjoy. And we'll talk about each individual device in September, again, because there are a lot of them, and there are pros and cons and according to your needs. But the best thing I can say really about clearance is, one, stay calm when you do it. Take deep breaths if you can, the deepest you can. That's the start of clearance. Moving the rib cage, taking deep breaths, staying calm, and trying to get the stuff up. Again, I don't want to go into a lot of details because I could spend 15 minutes on each individual type of clearance technique. And I do want to get those out to you, but in a better form. This is just a general overview. Anything else that you want to hear from me? Or that you would like to hear from me?
No, I think that's great. I mean, we do have a lot of questions, and you know what I would like to do. Did you mute?
Oh, sorry.
We're gonna have some fun tonight. I did say it's the last day of school, so we're gonna put Marion on the hot seat a little bit, and we're gonna let her field a lot of these questions. And I would say if she doesn't know the answers, then I will answer them, but that would be kind of cuckoo and condescending. But I won't. But I also know that she knows everything I know plus. But we're going to talk about a lot of these things. One thing that Marion said that is so true is that, you know, there really is not, you know, what people don't realize is that there's not one size fits all with these things, okay? There are so many devices out there. I mean, at one point there was only the Flutter valve, okay? So that's what people used. Then was the Acapella. Then there was this. I don't know the chronological history of when each device came out, but you know, that's where really understanding the device comes in, and not for you. You have to understand which device you use, but as a clinician, physician, chest therapist, respiratory therapist, whoever else is going to be prescribing this device for you or training you in this device, they have to understand the nuances, because what's going to work for a 97-pound, 5-foot woman who's in the step-down unit of the hospital is not going to be the same as is going to work for a 200-pound football player who blah, 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 blah. You get the point, okay? And so there's not that many people that really have experienced these devices, experienced all of them, tried them all out. They've tried the Flutter or the Acapella or the Quake, or they've tried one. I mean, look, if we like chocolate ice cream, we generally order chocolate ice cream, okay? But only by knowing the beautiful flavors of ice cream can you really make the best choice for you. I'm not advising eating ice cream, people. But Marion is really, you know, she understands these devices in a way that I really hope I don't ever understand, because there's just so much to it. And one of her greatest strengths, and you know, again, I'm shamelessly plugging here, but it's really true, but one of her greatest strengths is really being able to size up a patient and help figure out what is going to be the best device for them. And that's why next month, when she talks about these different things, one of the things that I know she's going to talk about is who is this device best for. So, you know, she'll give you examples of who might consider the Quake over the Flute versus the blah, blah, blah. So that you can ask more informed questions of your physician, because, you know, like anybody else, physicians are people and they get comfortable with a device or, you know, a distributor or so on and so forth, and that's what they prescribe. So again, just to recap, okay, ultimate pulmonary wellness, medicine, having the right doctors, taking the right medications, taking it properly, exercise, nutrition, stress management, relaxation training, prevention of infection, recap, prevention of infection, okay? Frequent hand washing, avoid people who are sick, Purell, secretion clearance, don't use a handkerchief, throw away your tissues, don't shake hands with people, avoid the children if they're sick, so on and so forth. And we're going to come up with some kind of respiratory gang signal, so that when people want to shake your hand, you could give them the signal, and you know that not Bloods or Crips, but pulmonary gang, so that they can know that you're not shaking hands. So let's talk about some of these questions, and I'm gonna leave most of them to Marion, unless somebody lobs me in a perfect meatball, which I'll try to hit out of the park. So let's go to some of these. Okay, so Dr. Noah, or I'm going to say Marion, why do I have various triggers that set off my mucus response and shortness of breath, and other people are not affected? And that's from Star.
Star.
If that's your real name, or if it's been changed to protect the innocent. Okay.
I mean, I'm not a doctor, but there are lots of triggers that trigger some people and not others. It's the same for not just lungs, for many things like migraines. It's the same kind of thing. This person, it might be light. This person, it might be perfumes. But whatever it is an adjutant to you. It could be allergies. It could be many different things. That is something for a doctor to diagnose. However, what I tell people to do is keep a log. I say this all the time to patients. Keep a log. Write down like what you did that day. Did you go to the theater? Was there perfume there? Did someone visit you? With perfume? What was the weather? What was the humidity? What was the barometric pressure? What were the allergens? What was the ozone level? All those things. Keep a log. Do you know if you kept a log for 2 weeks to a month, you would start to see a pattern. This doesn't do it, but this and this does it. This doesn't do it at all, ever. This does, all the time, without any other of the other things present. So you'll at least learn to know your triggers and what they are, and at least you'll feel a little more confident or know in advance, oh, it's this way. Okay, I'm not going to feel great today, or I'm going to have a lot of mucus today. And then you can sort of learn how to deal with it a little better during your day. Does that help?
That helps. That's a great answer. In adding to that, avoid your triggers, okay? So people ask me all the time, I have bad allergies and I have 7 cats. Is this a problem? I'm allergic to cats and I have 7 cats. Is it a problem? That's a problem, okay? I have a cat. I also have a dog, just so you don't confuse me with a pure cat person. But I have a cat. I'm allergic to cats, okay? I love this one particular cat and I'm not getting rid of him. So I take Claritin D every night to prevent my nose from closing up, okay? So ideally, avoid your triggers. Marion talked about, what are your triggers? What are your allergies? Go to a doctor to find out what are your true allergies, okay? And a lot of times, people with respiratory disease are treated only by a pulmonologist. And that's great because so many pulmonologists are really tuned into these different triggers and allergies and things like that. But if it's resistant, or if you have things that aren't, if the puzzle's not completely being put together, bring an allergist into the picture. Bring an ENT into the picture. Bring in whoever you need. But really avoid your triggers, okay? And sometimes you can't always avoid your triggers. But let me just give you one example of something that I see in New York City all the time. When they do construction, okay, in New York City, a lot of times they'll be demolitioning a building, and these guys bring all that sheetrock out into the street, and it's in a giant, what do they call those things? Container, I think they call them, dumpster or container, okay? And these guys are pounding the crap out of these giant things of sheetrock, and the whole street is practically white. You feel like you're in some kind of desert storm of some sort, and they're all wearing these high-powered masks and bodysuits, okay? Use your head, okay? It's like when I used to come to the hospital sometimes, some of the guys that are doing the cleaning, okay, they're wearing masks, they're wearing protective gear, they're wearing boots that are strapped up into their pants. Now my question is, what are you spraying that you have to dress like that? You know what I'm saying? Or what are you doing? Obviously, if somebody's geared up like that, that needs to be something that you pay attention to. So if you see that, guess what? Across the street or 20 feet ahead, they're breaking up some sheetrock, then either cross the street, or as crazy as this sounds, walk to another block, because believe it or not, even one exposure to that, if you're susceptible, can be enough to actually get into your lungs, trigger that inflammatory response, bring up all that mucus, cause you to produce a lot of mucus, and that could be enough to get you sick. So avoid your triggers, know what they are, and avoid them, okay? So let's go on to the next question. Have you developed a polite way to say, I don't shake hands? I don't know if this is polite, but I go like this. Or I go, that's disgusting. You know what? I think that, sometimes what I do is I bow to people. I mean, I'm not Japanese, but I like this idea, okay? Or something like this. In Mexico, when you pass people, this is what they do. It's a sign to say respect from my heart, okay? And you could say like this and take a step back, and I think people get the idea. I mean, occasionally you're going to find that person who's coming in from across the room and is really going to, but that's when, Marion?
Again, I think there's nothing wrong with politely saying, oh, hey, sorry, I, have lung disease, I don't...
You're muted still.
Oh, am I not? Boy, a lot of people would like to mute me like that. I'm just talking to my husband. Anyway, I think there's nothing wrong with saying to somebody, even if they're coming across the room, just, I'm sorry, I can't shake hands, or I don't shake hands. I have a, I have a disease, I can't shake hands, or, some reason, but again, I always go back to it's whose life is it anyway. So you know what? If you say it's all how you say it. If you say it a certain way, it's not like, oh, I don't shake hands, as opposed to, I'm sorry, I can't shake hands. There's a difference, and that's all it is. But it's your life.
Yeah, I mean, that's a great point. I mean, this is Judy's question, and Judy, you said that you've said germs, and people have told you that's impolite. I mean, the only thing about germs is like, I guess people could take that as being like cooties, or like something like that. So I think Marion says it right. It's all in how you say it. But at the end of the day, I mean, if for those of you that know me, I mean, I don't worry that much about what other people think. I kind of do what I think is right. And let's say Marion's contaminated, and she's somebody who really needs that handshake from me, okay? And she comes in and she forces me. I'm not gonna do it now. You notice my quick reflexes, but she forces me to do that handshake, and then guess what? Next week, I'm laid up in bed for 10 days, or worse, I'm in the hospital, okay? Trust me, she's not necessarily coming to visit me, or she's not necessarily even thinking about me, okay? So again, when it comes to your health, this is a war, okay? So fight on, people. And if somebody thinks that's impolite, so be it. I'd rather be impolite than have pneumonia, so that's basically it. For Mary, thank you for the smiley face. Here's some other questions. How about public pens at hospitals? We have to sign. Doctors' offices, their pen stores, they have pens on a chain. Absolutely. That at the Pulmonary Center, we give out pens to everybody. We have beautiful pens, okay? But not just pens. Think about it. Anything that you touch, here's something kind of crazy, okay? And here, I'm going to bring this up to something that's crazy but gross, but also that you need to know. Going to the bathroom, okay? Let's use the airport as an example, okay? The overwhelming majority, and I've been in a lot of airports, the overwhelming majority of airport bathrooms are disgusting, okay? So now think about it, okay? Ideally, the bathroom is gonna have one of those automatic flushers, right? Because the last thing I wanna do is touch the flusher, right? So you wonder all the time, why don't people flush the toilet? Most people probably don't flush the toilet because they don't want to touch that thing that everyone who's just gone to the bathroom, and it goes the same thing for urinals, but they don't want to touch something that someone who's just gone to the bathroom has touched. Same thing, when you come over to the sink, okay, you have to turn on and off the faucet. So now think about this. Let's use this as the faucet, right? So I come over, I want to wash my hands, I turn on the faucet. My hands are dirty. I touch the dirty faucet because everyone who's turned on the faucet before me has had dirty hands, right? So I have to assume I'm going to touch a dirty faucet. Now, how do you get away from that? Here's what I do. Same thing with the paper towel dispenser, okay? If they don't have an automatic hand dryer or an automatic paper towel dispenser, and I've just gone through the trouble of washing my hands, but then I use the paper towel dispenser, the only good news about using the paper towel dispenser is that most people who are using the paper towel dispenser have just washed their hands. But let me give you the correct way of doing this, okay? So first thing I'm going to do is I'm going to take out the paper towels, okay? I'm going to turn on the faucet, wash my hands, take the paper towel that I've already taken out so that I don't have to touch anything that anyone else has touched. Take that paper towel, use that to turn off the faucet, and think about it, walk over to the door still with your paper towel, open the door with your paper towel, throw it out, you're out home free. Because let me tell you something, you could wash your hands till the cows come home. If you still have to open that door, you're still touching the door that everybody who didn't wash their hands has to get out also, okay? So just think about that. Again, politeness, I believe in politeness to a point, okay? You have to be polite, you try to be courteous to people, but again, do I want to be polite and have pneumonia, or do I want to say to somebody, and there's a difference between being assertive and being impolite. A lot of people say that I'm direct, or I have a way of saying, some people say I'm rude, and look, maybe I am rude, okay, but again, if I need to tell you something that is for your safety and the safety of everyone else, I'm going to tell you directly, okay, and you could say the same thing, you know what, arigato, I don't shake hands, you could do this. I mean, I think the more dramatic you make it, the worse it's going to be and the more it's going to be taken. But anyway, I think we've beaten this dead horse to a pulp. Another question from Barbara, why is whether your mucus thick or thin important? And I think we touched on this. So again, the thicker your mucus, okay, the harder it's going to be for you to clear it, the greater incubation pad you have for bacteria and virus. I drink 8 to 10 glasses of water per day and it doesn't seem to affect the thickness of the mucus. That's a good question. So again, I said it's not just hydration from the inside out, okay? It could be the air you're blowing out. Now, if you mean it doesn't seem to affect the thickness of the mucus and you're already pretty thin, then by all means, that's great, okay? But if you're thick, in other words, if you're drinking 8 to 10 glasses of water a day and your mucus is thick and dry, again, think about humidification, think about rinses, nasal rinses, think about steams, think about nebulizers with saline solution, all of which you need to clear with your physician first. Anything else you want to add to that, Marianne?
Yeah, when it comes to my favorite topic, mucus, sometimes, you know, there...
Oh, you're not on start.
Okay, can you hear me now? I'm not pressing my button hard enough. I keep pressing it, and I'm pressing it.
She's off still?
Am I off? Okay, now can you hear me?
Yep.
Okay, sorry about that little technical difficulty. I love talking about mucus. You know, your mucus, there are different consistencies of thickness as well, so that there are people who are always going to have a thick mucus, but there's some people where it comes out so thick and sticky that they can cough into a cup. I can turn the cup upside down, and you know what? At the end of the day, that mucus will still be at the top of the cup. Now there are people that also will cough up a thick consistency of mucus, but it's got a little bit more viscosity where you turn it over and it will start at least flowing down. So that mucus is going to be a lot easier to cough up, even though it is thick, than the one that is so thick and sticky that it can't come up. And sometimes it's just going to be the disease process. But if it's thin, if you can cough it up with that amount of water, you know, if you're taking enough fluids in, if you're doing enough to hydrate yourself, if you're maybe even taking a medication to help break it up a little bit, you know, and you are coughing it up, that's a good thing. So, you know, it also helps sometimes to, if you're drinking your 8 to 12 cups, to sip it constantly through the day instead of just drinking large big cups at one at a time.
Okay, next question. Mowing grass, is that an issue? Okay. Again, I think that the key to that is mowing grass one of your triggers? Okay, if you're allergic to grass, then by all means, you know that's going to be a trigger. Okay, so if you're not allergic to grass, if it doesn't trigger your mucus and your inflammatory response, then by all means, then go ahead and mow the grass. In fact, come to my place and mow my grass. Next question. I have a farm. I deal with horses, goats, chickens, etc. Should I be concerned? Please don't tell me to get rid of my animals. Okay. I would never tell someone to get rid of the animals that they love. Okay. I am a super animal person, and that includes all animals except snakes, and I do respect snakes, but I just am afraid of them, okay? But I love all animals, and so I know what it means to have a pet, to have an animal that you love and that you don't want to part with, okay? People say to me, oh, you have a dog in the city, isn't it this or isn't it a trouble in that? And what people don't understand is that the overwhelming joy that you get from having an animal really can't be replaced. So if it means that I have to treat my allergy in order to make that happen, by all means, I'm going to choose that over getting rid of my animals. So you say, Mary, you have a farm and you deal with these different things. Again, I think this is where a little preparation can go a long way. And what I mean by that is know your triggers, okay? In your case, I think it's super important to make sure that you're taking your medications properly, particularly the anti-inflammatories, to make sure that you know you're going to come in contact with things that may trigger your inflammation. So make sure that you're taking your medications properly. Again, ask your doctor, are there other medications that you may need to take in order to prevent those different types of attack? Also, frequent hand washing, frequent clothes changing. If you know, what's that?
Yeah, I was going to say clothes changing.
Change your clothes frequently, okay? If you know that you're covered in dust, or you know that there are certain activities, and this is the city boy in me speaking, but things like baling hay or spreading seeds or things of that nature, then by all means do that activity, but then go take a shower and wash your clothes so that at least you're not being constantly exposed to those things over and over and over again. Okay, so here's another question. I just got a Portex Acapella Vibratory PEP system to help get rid of mucus. They said to sit up at the table with elbows on the table and then do this. What about laying down, as you mentioned, to help get rid of mucus? I'm not going to speak specifically of this now, mainly because that is the topic of next month, okay? A lot of times, Marion, I know, has specifically developed protocols that are even different than what some of the manufacturers recommend, that have been more effective and that we've approached the manufacturers with. So again, it's very individualized, but Marion will hit that in great detail next month, unless you want to address
Well, let me just address that because they're using it already. Let me just address that because you're using it already.
No, you're not on.
Okay. Now can you hear me?
Nope. Let me see that. Try it.
Okay, got it? Okay.
Yep.
So I want to address that because you are using it already. The thing about the Acapella is I use it for usually for general clearance. So in that case, I'll have somebody sitting upright. But if there's a certain part of your lung that needs draining, or if you get it up more easily in a certain position, then by all means, that's a good position for you to do it in. The great thing about the Acapella was it was one of the first of the valves to be designed that you could do it in a specific position, so you don't have to just do it sitting up. If you have, for instance, pneumonia on your, let's say, left side of your lung somewhere, in your left lung field, you can lay on your right and use the Acapella, and it will help vibrate the left side and help move that stuff out. So if that is a good position for you, if you find it successful and working for you, then by all means you can use it in that position. Generally, I do teach it, to just clear the lungs, and I have people sitting up. I don't necessarily use the leaning on the table. So, again, it's very individualized, but if that works for you, then absolutely do it, and it can be used in any position. The great thing about the Acapella is you can hang upside down, and it will work in that if you're holding it properly.
Okay, great answer. We're going to go to a couple of other questions. So I can bring up the thick mucus. It's often like slightly beaten egg white thick. Okay, again, increase your fluid intake. See if that thins it out. Here's a question from John. Does taking NAC stop mucus production? And the answer is no. There's absolutely nothing that is going to completely stop your mucus production, nor do you want something to completely stop your mucus production. Remember what I said at the beginning, which is that mucus in the normal circumstance is a protective mechanism for you. So if we had no mucus whatsoever, trust me, you'd be getting sick quite a lot. Next question, and I'm going to go a little quickly now because we have 11 minutes left, but my husband frequently runs low-grade fever with no other symptoms. Is this something to be expected? He has IPF and takes 20 milligrams of prednisone per day. Thank you. Okay, so again, is a fever to be expected? No. A fever is telling you that the body is working hard to fight something. So are there some people who run a low-grade fever frequently? Absolutely. But again, in a situation like this, I would want to know, is there something that is causing this fever that maybe is not being looked at immediately? And again, sometimes with a pulmonary patient, the number one thing that people are going to look at right off the bat, of course, is going to be a respiratory infection. So that could sometimes blind you to the fact that, hey, maybe, you got cut last week on a rusty nail or something like that. So again, if something's not right, I don't want a doctor to stop and say, you know what, it's probably this. Or if you have a fever, that to me tells me that something's probably wrong, and I'd want to really do a thorough, I'd want your doctor to do a real thorough workup, including blood tests and other things to make sure that there's not something getting missed. I cough upon getting up and then after eating meals or drinking water. This is Marianne. So is there anything I could do to help this? Okay, so great question. Okay, let's talk about that for a second. So we talked about why do you cough upon getting up. It's because when you've been sleeping for the whole night, your mucus has had a chance to drain, and so when you wake up, it's in a position for you to cough it out. Okay, now here's something to think about. After eating meals or drinking water is a potential concern, okay? Because what you need to know is that The trachea, which is the windpipe, sits very close to the esophagus, and there's something called the epiglottis, which is supposed to protect from food going into the trachea when you're eating, okay? So if this is happening regularly when you're either eating or drinking, that raises a potential red flag that maybe you might be doing what we call aspirating, which means that food might be going, instead of into your esophagus, it may be going over into your trachea. And so that's something I would absolutely discuss with your physician. And the test that they might consider, recommending is called a swallowing study, to see if when you're eating, different foods of different consistencies, are those foods going into your airways? Okay, it's rare that my mucus is clear. It's usually light yellow or light green. Again, there are a whole host of patients, particularly with a chronic respiratory disease, that are going to have secretions that may always be light yellow or may always be light green. Again, that's something that needs to be discussed in detail with your doctor. Okay, let's see. I have a resistant form of MAC along with other lung problems, and this is Carol. Unable to take meds because of chronic gastritis. Why do I have more mucus production after eating? And again, this makes me want to ask the question, are you possibly aspirating, okay? And that's something that's easy to find out. That's the last of the online questions. I'm gonna hit a couple of questions that were mailed to me. Jonathan, I know you've been asking this for several weeks, and I finally did some research on this. Is hemp oil efficacious in assisting lung function, okay? I've read probably 10 articles over the last week about hemp oil. Now, it's real important to delineate the difference between anecdotal claims or claims by manufacturers that may or may not be true versus true research studies. That being said, I did see a number of studies that report that some people do benefit from hemp oil, particularly one of the differences between smoking a marijuana product versus smoking a cigarette would be that whereas one causes bronchoconstriction, they have found that after using hemp or cannabis, people do get some bronchodilation. Again, I don't think that this is something that you should immediately run out and buy a bottle of hemp oil without discussing it with your physician to make sure that there's not something that maybe is particular to you that could make it dangerous, okay? Again, as I mentioned over and over again with any type of lifestyle change, you really don't want to do anything without clearing it with your physician, because a lot of these things can sometimes do more harm than good. Dale, I have stage 4 COPD, but I really don't have much mucus like other people I often hear talk about. Do you know the reason why? I'm constantly drinking water. Would that be one of the reasons? Now, that could be one of the reasons, that your secretions are clear and thin, and as Marion mentioned, that they're constantly coming out over the course of the day, as opposed to thick globs of mucus. But again, the question is it that you don't have it? Is it that you have it that it's not coming up? As long as your doctor tells you that your lungs are clear, then more power to you. Okay, so a couple more questions from Al. Love your webinars and will definitely order a signed copy of your book when it comes out. Al is obviously very smart. Your webinars educate and entertain me. He obviously also has very good taste. But getting to the meat of it, Al says, I have COPD alpha 1 with a 24% FEV1, so breathing is important. I'm on O2 at 2.5 liters 24/7. Okay, and this is a great question for Marion. I do diaphragmatic breathing exercise of 2 in and 4 out, counting to 50 total in about 5 minutes, and I do this about once every hour if I remember to do this exercise. I do not get out of breath, and these are easy to do. Am I hurting anything by doing these exercises? I seem to breathe and feel better.
Yeah. Oh, good. I'm on this time. Al, this is Al. Al, more power to you. I mean, that's how everyone breathes. That's how you're supposed to breathe. Diaphragmatic breathing. So all you're doing is actually every minute or whatever, every hour, giving yourself some time to actually breathe the way we would love you to breathe. So if you could do it once an hour 50 times, you should now be working on breathing that in, bringing that into your daily to every minute breathing. This should now be a part of how you breathe, that diaphragmatic breathing, and becoming more aware of trying to bring it into your life more often as opposed to it being an exercise.
Great. Again, Al, you're doing what we wish everybody would do. And Marion talks over and over with people, the diaphragm is a muscle. So the more you train it, the more effective it's going to be. Question from Henrietta, is there a right or wrong way to use a flutter valve? I have one but haven't started to use it. Fearful if I operate it wrong, it will do more harm than good. Marion, tell me if you think I'm wrong. I don't think it's going to do more harm than good, but like I said, in September, Marion will be going over correct techniques for all of the different devices, giving you a few tidbits here and there.
Let me just say something really fast.
Yep, go for it.
Am I on?
Yep, you're on.
I'm on. Okay, since you're using it already.
She said she's not using it.
Oh, you're not using it already. Let me just say, if you're using it wrong, the thing is it's just not going to work. So if you're using it properly, if it's the right device for you, it should do something and work.
It's not like saying, I'm thinking of assembling a bomb, but I am afraid that I might not be doing it correctly. It will do more harm than good, okay? Most of these devices are fairly benign in the sense that even if you're not doing it exactly right, you may get some benefit from it. Am I right about that?
Not with the Flutter.
Like I said, with the Flutter,
not with the Flutter.
If you're doing it wrong, you're not going to get any benefit from it. That's what I meant.
Yeah. The Flutter, if you're doing it wrong, it's not going to work. It's just not going to work properly, and it's not going to do anything. If you're doing it right, it's going to work.
And that's why she is the chief of the airway clearance unit, ladies and gentlemen. Okay, so let me talk just a few things. We have 3 minutes left. Again, you know, I just want to thank everybody for tuning in every week. Again, I want to thank the American Lung Association, the American Lung Association of New York, 21 West 38th Street, Serena Arabito, and all the people you know, who have supported us along the way. I thank all of you for signing in. We've had, you know, really, I could say without question, this has been our best seminar season ever. We've gotten to hear from people in all 50 states and in 7 different countries and 3 different continents. And you know, we hope to take what we've learned in this time and make it even better. One of the things you could look forward to in the next season is I plan to have a physician with us on every single broadcast, and so that we could really tap into the minds of some of these pulmonologists, cardiologists, you know, gastroenterologists, ear, nose, throat doctors, allergists, because you know what, we get veterinarians, maybe not, but you know, we really, you know, by working with so many different doctors in New York City, we really get to see the various practice patterns, and we get to see who's doing what, and we know what the tendencies of different people are. And you know what? The more information you have, the better it is. And you know, I say all the time, most of what I've learned from my patients. The second amount of what I've learned is I've learned from watching doctors take great care and sometimes not so great care of their patients. So what I plan to do in the fall is to really bring in the top doctors that I've worked with over the years to really hope, you know, educate you even further and bring in some more insight to this. On the final announcement is that previous webinars have been added to our website, www.pulmonarywellness.com. They are under the web archives button. I also want to thank Nicole Spiletic and Chris Leung, my tech team, who really, without them, you know, both these guys, I want to say, you know, I had certain expectations about what this webinar series would be like. It has by at least 10 times exceeded what my hopes were, and I have to say it really has mostly to do with my tech team, who have really brought us to the next level. And you know, we continue to always be expanding. You know, one thing you know about us is we're never satisfied, and next year is going to be even better. We thank you for tuning in. If you have questions, comments, feedback, by all means, feel free to contact me, noah@pulmonarywellness.com. And good health, don't worry, you will be okay without us for August, and we will see you in September. Good night, and thank you very much.